Ryan Reynolds here from Mint Mobile. With the price of just about everything going up during inflation, we thought we'd bring our prices down. So to help us, we brought in a reverse auctioneer, which is apparently a thing.
Mint Mobile Unlimited Premium Wireless. How to get 30, 30, bit to get 30, bit to get 20, 20, 20, bit to get 20, 20, bit to get 15, 15, 15, 15, just $15 a month? Sold!
Give it a try at mintmobile.com/switch.
$45 up front for 3 months plus taxes and fees. Promo rate for new customers for limited time. Unlimited more than 40 gigabytes per month. Slows full terms at mintmobile.com.
The NIH estimates that up to 50 million Americans have an autoimmune disease. About 1/4 of these people will develop additional autoimmune diseases, like Ayanna Chase Webster has. And while all Webster wanted to do was be able to ignore her conditions, the constant flare-ups made it hard to do.
So stress, environment would send me to the ER frequently, especially while I was working full-time, because I didn't know balance, work-life balance. I didn't really pay attention to my body. I just lived life as if nothing was wrong.
Instead of focusing on her own health, Webster put all of her energy into supporting the friends and family in her life. But every time her illness eventually caught up to her, it'd flip Webster's life upside down.
Complete and total exhaustion, pain upwards of 10, the inability to perform daily functions, to take a shower, to cook my meals.
Even walking through her home became a huge challenge. Webster's flare-ups can last for months, but seeking treatment wasn't always an option. She's recently gone through tough times, no longer being able to afford payments on the house she'd lived in for 15 years. So it wasn't long before Webster was overwhelmed by the stress of her disease and financial struggles.
I lashed out. I became angry, and as a result, became involved with the court system and needed to sign up with what's considered a core services agency in the district because I was without health insurance, so I didn't have a therapist. I was allowed to participate in the mental health court because of my circumstances so that charge wouldn't follow me and it would get dismissed.
Through the court system, Webster was referred to Volunteers of America, a nonprofit that provides affordable housing and services. Their new service, called Hope Has a Home for Women, is the first medical respite program for homeless women in the D.C. area. LaToya Ramsey, director of peer services at VOA, explains that this temporary housing is specialized to provide care for people experiencing acute illnesses or recovering from a condition.
It's specifically designed for those who are experiencing homelessness as well. So within the program, we do have 24-hour medical staff that provides the medical needs. And also too, we have 24-hour staff that provides the housing needs as well. And when I say housing needs, it's building rapport, checking in to make sure consumers are doing okay, and helping them navigate daily living.
2016 was the first time a set of standards was created for medical respite programs. The criteria, which were revised in 2021, are based on the principles many would expect, like safe and high-quality accommodations and timely treatment. And though it's a necessary service for so many people, the availability is extremely limited. The Department of Housing and Urban Development estimates that more than 600,000 Americans are homeless, but there's just over 100 medical respite programs across 38 states.
Hello, I'm Anthony Anderson. When UNCF, the United Negro College Fund, was founded 80 years ago, they hoped they would change this nation for the better, and they have. As a proud alum of an HBCU, in fact, Howard University, I'm an advocate for HBCUs. I support the work that UNCF does for students of color, scholarships, and internships for 50,000 deserving students each year. Visit uncf.org today. And remember, a mind is a terrible thing to waste.
If you're struggling to lose weight, you've probably heard about weight loss medications like Wegovy or Zepbound, and you might be wondering if they're right for you. Meet PlushCare, a leading telehealth provider with doctors who are there for you day and night to partner with you in your weight loss journey. If you qualify, they can safely prescribe you medication from the comfort of your own home. To get started, visit plushcare.com/weight-loss. That's plushcare.com/weight-loss. plushcare.com/weight-loss.
Without access to this care, many are forced to recover on the streets after their discharge from the hospital.
Most of the housing for homeless or those who are disadvantaged does not provide any medical care. And so it leaves individuals to have to go and recover at either a relative house or even on the streets, as places cannot reserve their bedding. So the need for there to be a medical respite facility in DC is very significant, where it provides a person a place to stay and not have to worry about losing their housing, but also to get the assistance, the medical assistance as they're recovering.
DC in particular already has a few male-only medical respite homes, so this new facility, which opened in March, is the first to serve women. There's no other barrier to entry, which Webster's thankful for.
I am grateful that someone had the insight to formulate a program for women without children who are in need of assistance. Because for so long, there are so many programs out here for women with children. Well, because of my medical conditions, I'm unable to bear children, but I still needed the assistance that I'm getting.
There's 2 phases of recovery at Hope Has a Home. The first step provides a lot of care, guidance, and assistance.
So for those who are coming in straight from the hospital or off the streets with medical needs, the first phase 1 is pretty much 30 to 90 days. That way they're able to address their medical concerns and also do touch bases with the provider to see where they are in their healthcare status.
Ramsey says these facilities are equipped to help all types of conditions. Some people are recovering from a nasty infection, while others just received a major surgery. And unfortunately, healing doesn't always take a straight path. Ramsey says there's a man that the VOA was helping to manage his diabetes in phase 1. However, after some complications, he ended up needing an amputation.
So being that he is homeless and he did have the surgery, he's coming back to phase 1 where he's actually receiving wound care. They're still monitoring and check to make sure that his levels are appropriate. And then also to making sure that he's seeing his physicians on a daily basis, as he needs to make sure he's touch basing with them. So those are the real core things that we do in medical respite. It's the after follow-up. So it's to see how you're doing, that hand holding, to make sure that you are doing everything according to what your physicians say. And if things are not working, like medications are tricking you in a different way, we're able to evaluate it, to send suggestions over to what may possibly need to be tweaked or different regimes that need to be implemented.
Webster was in need of both physical and mental health care. Since she had lost her private health insurance before entering medical respite, Webster had been neglecting all of her health issues for a while. So the first step was seeing a primary care physician. Now, after spending more than 60 days in phase 1 of the care center, Webster's feeling stronger than ever. Once the injuries are addressed and the patients are stable, they can begin phase 2.
And phase 2 is going to be your, I would say, light checkup as far as the medical care. But also, too, it gives them an opportunity to practice in a safe housing component, the things they need to make sure they check up on daily. So making sure they check their blood pressure or they check their sugar to make sure that they're taking their insulin properly. With having the light touch base of the nurses to make sure they are in compliance with their medication regime.
The goal is that I matriculate and I'm able to sustain myself by myself without that level of care that's offered at Medical Respite 1. So just a house monitor, 24 hours a day. I'll need to provide my own transportation for groceries, for appointments, for errands.
Phase 2 can last anywhere from 90 to 180 days, and it's meant to be a transition out of care. Ramsey says they partner with other programs to help patients address behavioral health issues like addiction, enhance their social skills, and find new housing.
So we actually have a clinical licensed social worker who provides the core case management. And that person is identified with connecting them with longer-term housing, whether it's going to be permanent supportive housing, a longer-term housing program, or also navigating to see if they have family members that they can stay with until their housing voucher comes available. Our overall goal is basically to be supportive of those who are experiencing adversities, homelessness, injustices, and be able to be that warm support and also to fight along with them.
You can find out more about LaToya Ramsey, Ayanna Chase Webster, and all of our guests on our website, radiohealthjournal.org. For more behind the scenes, follow Radio Health Journal on Facebook, Instagram, and X. Our writer-producer is Kristen Farah. Our production manager is Jason Dickey. I'm Greg Johnson.